Yeah, good evening. Okay, so let me welcome you to today's lecture. Last week we introduced the other part, the second part of the course, which is ethics and public health legislation. And then we introduced ethics. We talked about public health practitioners as that public health practitioners are professionals, and because they are professionals, they have clients. They have clients like doctors, like lawyers, okay, or yes, in fact, professions. They have clients, and then what is commonly agreed or what is common in all professions is the fact that you owe your clients the best of your ability, the best of your ability. In fact, you are trained. You are given the training to ensure that you give your clients the best quality service. Okay, and we said the general public is our client, is a client of public health practitioners, and then that when we are given that post, when we are given the position of a public health practitioner and public health practitioner, especially when we are employed with a public health degree, it is assumed that you have that competence. It's not paper, because public health is not is not academic. It's professional. So you must show working. You must show working. So yes, you must show working. And so if you are employed and you are expected to give your best to your clients, which is the general public. But if due to one reason or the other, you are unable to meet that minimum acceptable standard, you can be held accountable. You can be said to have committed a malpractice. And malpractice are of three types. We talked about nonfeasance, which is not doing anything when something is needed. We also talked about misfeasance, which is not doing something but willingly doing inappropriate thing. And then we have malfeasance, which is willingly doing something that injures the client. And we gave different examples. So today we are going to look at the ethics of public health, and especially the principles that guide public health practice. And these principles are called equity and social justice. Equity and social justice. Equity and social justice. In public health, we have responsibility over a community, over communities and the general public. So we're expected to take care of everybody in a certain way. So if we are given resources, we are expected to share it in a certain way. And in public health, the principles that guide the sharing of public health services are called equity and social justice. We know that those of us in Nigeria, we know that our health indices are not actually the best, in spite of the fact that Nigeria has one of the highest economy, one of the largest economy in Africa, one of the largest economy in Africa, and we even have the highest number of health workers. Yet the health indices of Nigeria is one of the worst. It's one of the worst in Africa. But even at that, there are disparities in Nigeria. Because the North health statistics of the North that of the South, that of the South, and then even within states, the urban centers, they have better health indices compared to the rural areas. And we said, we in public health, we believe that this shouldn't happen. This shouldn't happen. And that is what we call inequity. That is what we call inequity, because it is not inborn, it is not genetic, which means it's man-made. And if people in rural areas are not having good health care as good as those in the urban centers, then we are not doing right. We are not doing right. We are creating inequities. And that is what we try to avoid in public health. That is what we try to avoid in public health. And we do that using these two principles: equity and social justice. Equity and social justice. Equity and measures is defined as equity is defined as treating equal. So even if people are not of equal standing, we have to treat them equal, and we have to ensure that everybody has a fair opportunity to attain their full health potentials, irrespective of their place of origin, their place of residence, their state of origin, political affiliations, and then religion. We are supposed to do that. We are not supposed to discriminate, even if a section of the state or a section of the country didn't vote for you during the election. It shouldn't be the reason why they should be denied health care, especially the basic health care. It shouldn't be the reason. It shouldn't be the reason. Okay, and in public health, it shouldn't. When we are planning for public health, it has to be based on equity, and equity is to treat unequal equal, to give people resources according to their health needs, and not according to their health needs. Okay, for social justice. Social justice is the process of ensuring that once somebody discharges his or her responsibility as a citizen, then the state, the government, has to reciprocate by providing that individual with what he or she needs. Providing the individual with what he or she needs. And these what individuals need as a human being is called fundamental human need. That is also fundamental human rights. But in this case now, we are talking about fundamental human needs. And what are the things that human beings need? We need water. We need proper sanitation. We need healthcare. We need housing. Those are the fundamental human needs. And then, so it should be the responsibility of government to ensure that every individual, every citizen, especially citizens that have paid their tax, should be able to enjoy all these the fundamental human needs. Then, for equity and social justice, it's usually done by taxing everybody equally in a country. Equity and social justice is done by taxing everybody equally. So when we pay our tax, we don't pay equally. Not everybody pays equally. Pays the same amount. No, it's not like levy, community levy. No, it is usually based on the person's income. What is called payee. So payee is a process where, of course, you pay as you earn. So it enables the rich to subsidize the provision of health services for the poor. Okay, so and that is one of the most important principles used in governance. Pay as you earn. And even if it is even entrenched in the Bible, in the holy books, in the Quran and the Bible. In the Bible, they talk about tithe, and tithe is 10%. I think, yes, 10%. So my 10% is not the same thing as Dangote's 10%. Okay? So which means that although we are paying the same percentage of our income, but we are paying the same percentage of our income, but we are paying different amounts because of the size of his own income. So it's pay as you earn. That is what how taxation is carried out, and it is to ensure social solidarity, so that the rich will solidarize with the poor in the provision of basic services like healthcare. Okay, so part of the ways in which governments ensure that ensure social justice, ensure that social ladder, that even the children of the poor can rise probably through education, is by providing public schools. It is unfortunate. It is unfortunate that in Nigeria, public schools have effectively been abandoned. It shouldn't be so. Public schools should be good enough so that the children of the poor can go to these subsidized public schools and then aspire to the highest level. And during my time, yes, it was like that. It was like that. I went to the same secondary school with the children of commissioners, with children of very big men. We are all in the same class. But right now, it is not so. It is not so. It is not so. And it is because the public schools are not. Okay, so government supposed to provide we pay our tax through the payee system, and then we pull these resources, we collect these resources and use them to do social insurance. Social insurance is another way where people pay premium based on their ability and not based on the sicknesses they have. Okay, so those are the things. Then the other thing too is how do we ensure equity? You said equity is to treat unequal equal, and it means sharing resources to an individual based on his need, not equally. So we have to distinguish between equity and equality. Equity and equality, we have to distinguish between the two. For equality, you give everybody equal share of the national cake. That will not be good enough. That will not be good enough. What is better, and that is what is used in public health, is equity. And equity is to share resources according to the needs of the people, of the person, such that persons in great need receive a higher share to bring them to the acceptable level of health. So if assuming that health is seeing what is taking place on the field of play, you just know that if you share equally, this guy doesn't need it, but he has received his share, and he can see very well. Well, this guy, made normal normal size, the giant who doesn't need any assistance, the person of normal height needs assistance to see. So, and this dwarf, even when he has received his equal share, he still couldn't see. So, which means in terms of health, his health is not good enough to guarantee him social and economic independence. Okay, so when it comes to equity, is to share the resources according to the need. This dwarf requires double portion in order to see. Therefore, yes, so he is given double portion, and this giant doesn't need anything, and shouldn't be given. In fact, that is also what happens in healthcare. What happens in healthcare, in social health insurance, like in the UK, the basic the standard care is provided to everybody. Standard care is provided to for everybody. But if a very rich person decides that the standard care is not good enough for him, he goes outside. He goes for private care, and that is how it is. And that is how it is. And that is how it is. And that is how it should be. So we have to understand the difference between equality and equity. And in public health, we use equity. And equity is achieved not by leveling up the health status of the most disadvantaged and not leveling down, not bringing everybody down. What has been called the crab mentality. In public health, we don't do crab mentality. Instead, we concentrate on those that require our help. We concentrate on those that require help. We don't level down. We don't bring everybody down, but we only concentrate on those with special needs. And if you look at in public health, a lot of emphasis are given to maternal and child health, and is for a reason, because because they are the people with the most need in the population. People with most need in the population. Pregnant women, especially as they are carrying the future generation. And if the future generation is not well taken care of, they said the first 1,000 days of a person's life is the most important. If anything happens within the first 1,000 days, that person will be affected all through life. So it's the reason why maternal health is given priority, and then children, they are still in the formative age, and then they require good health care to survive and then to develop properly, and that's why we give them priority. Okay, so the other thing too is yes, in the world where it is believed that what's the resources of the earth is enough to take care of everybody. The resources in the earth is able to take care of everybody. So technically, it is believed that nobody should go hungry. Nobody should go hungry. Nobody should go without health care, especially basic health care. Nobody. Okay, so because they believe that there are enough resources in the world, and it is because of that the United Nations and WHO and UNICEF, they have over the years launched different programs of international spread to achieve certain things with the belief that there are enough resources. And these programs include the Health for All. Health for All is supposed to be by the year 2000. We have a Millennium Development Goal, which was initiated at the beginning of the millennium, and then Sustainable Development goals that were set upon the exploration of the Millennium Development Goals. For the Health for All, it was believed that Health for All is a program launched by the WHO in the 1980s, and the target was to ensure that everybody has a level of health that guarantees his social and economic independence. What is social and economic independence? Social independence means that that person, no matter his handicap, he should be able to interact with other members of the community, which means that if the person is disabled, he should have, physically disabled, he should have some mobility aid. If the person is blind, he should still be able to read. He should be able to read, and even navigate around his immediate community, okay, and so forth. So that is social independence. And then economic independence means that that person should be able to have a level of health that ensures that he's able to earn a livelihood. Is able to earn a livelihood and not depend on arms. Okay, or not depend on arms. Okay, so that was WHO, and they did a lot of things. That by the year 2000, Health for All, by the year 2000, they even started the primary health care. And primary health care involves provision of services that are outside medical services, like food security, like water and sanitation, and all those things. Okay, water and sanitation and all those things. All these things were included in activities geared towards health for all. Unfortunately, we still didn't meet it, in spite of the fact that a lot of money was spent. Then the NDGs were signed at the dawn of the 21st century, and the aim was to eradicate poverty, all forms of poverty, and some of the goals some of them are health related, For example, improvement in maternal health, control of HIV/AIDS and malaria and other diseases. They are all health related. Okay, and in Nigeria made a lot of effort, especially as the Paris Club debt was forgiven Nigeria with the agreement that the money saved should be used for NDG projects. So there was a lot of projects. Unfortunately, a lot of them weren't sustained. Then the SDGs came into force in 2015 after the expiration of the NDGs, and they were, of course, also aimed at eradicating all forms of poverty. Okay, but in practice, it has been difficult to treat everybody equal in Nigeria. It has been difficult. And it has been openly said. For example, one example is the amnesty program amnesty program in the Niger Delta, where militant youths were given paid scholarship and a lot of things simply because they took up arms. It shouldn't be. Okay, and then it shouldn't be, and then even on employment and a lot of other things, even health services are denied people that didn't vote for the government. Okay, that shouldn't be. That is against the principles of equity and social justice. Okay, and we have also talked about the health for all. In fact, when the WHO launched the health for all, it made primary health care as the vehicle for getting to health for all, for ensuring that health for all. And ensuring health for all. And in primary health care has to do with the use of bringing healthcare to as close as possible to where people work and reside. So health for all, primary health care was effectively used to achieve health for all. And as we said, health for all is just to improve the health. Is basically to improve the health of everybody to the extent that they are able to live a socially and economically productive life, irrespective of their illness. Okay, so let's just quickly we have talked about indirectly, we have talked about health as a fundamental human right. In the WHO Constitution, the Amata Declaration, and a lot of other declarations. In fact, even the Universal Declaration of Human Rights clearly stated that health is a fundamental human right. So in that Article 25, it states that everyone has a right to a standard of living adequate for the health and well-being of himself and his family, including food, clothing, housing, and medical care, and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, and other lack of livelihood in circumstances beyond their control. Okay, so in that case now, health is a fundamental human right. It is in the WHO Constitution. It is in the Amata declarations. It is also in the Universal Declaration of Human Rights. And unfortunately, before these conventions are made justiciable, they had to be ratified or domesticated by the act of the National Assembly. Unfortunately, Nigeria has not been able to do so. Nigeria has not been unable to do so. So even though Nigeria subscribes to the WHO Constitution, signed the Amata Declaration, and signed the Universal Declaration of Human Rights, you cannot, however, sue the Nigerian government for not providing health services. You cannot sue them. And you cannot sue them because the National Assembly has not ratified these conventions, and therefore the government cannot be sued. So perhaps we should put pressure on the National Assembly to sign them so that it becomes justiciable, so that we can sue the government if they fail to provide adequate health care to our people. We have to also say that we have to also appreciate the words of Mary Robinson. Mary Robinson was a former UN High Commissioner for Human Rights. She said, "The right to health does not mean the right to be healthy, nor does it mean that poor government must put in place expensive health services for which they have no resources. But it does require governments and public authorities to put in place policies and action plans which will lead to available and accessible healthcare for all in the shortest possible time." Okay, so it means that right to health doesn't mean that the government must provide quality healthcare, for which they don't even have, expensive healthcare for which they may not even have the resources. But the most important thing, according to Mary Robinson, is to have that intention. And it is believed that once you have the intention, the government, international organizations can help. Can help. So just to have the plan. If a government has a plan and it is seen that it doesn't have money, the international organizations, donor countries, philanthropists like Bill Gates can come in and help. Especially as it has been found that most of the health care services we require, we just cost $35 to provide. $35 per person per year to provide. So this is money that a lot of countries can afford. This is money a lot of countries can afford if we show the necessary political will. Unfortunately, in Nigeria, we may not, or we don't. We don't. Yes, we don't. And it is unfortunate. Okay, so and then I think we have to also talk about that 15% expenditure budget on health. It was what was agreed at Abuja, what they call the Abuja Convention. where African countries signed to budget at least 15% of their total annual budget on healthcare. Unfortunately, Nigeria, where it was signed, has not been able to meet this 15% budgetary allocation to health. Okay, so I have gone through. We talked about equity, principles of equity and social and equity and social justice. We're able to distinguish between equality and equity. And then we talked about fundamental human rights, health as a fundamental human right, as enshrined in the WHO Constitution, in the Amata Declaration, in the Universal Declaration of Human Rights. Unfortunately, they have not been ratified by our National Assembly, and therefore we cannot. It is this declaration is not justiciable in Nigeria. Therefore, we cannot sue our government. And then, okay, we cannot sue our government for that. Okay, so I don't know if there are questions or comments before we go to this the next one. Okay, let's just quickly take the Saracusa principle before we ask for our questions. Okay, the other thing too is the fact that for the Saracusa principle, the public health, one of the powers possessed by public health official is the police power. We talked about the police power, and the police power is the power to detain and arrest an individual deemed to be constituting a hazard to public health. So the public health agency and public health officials have that power. But it is usually said that absolute power corrupts absolutely. Absolute powers corrupt absolutely. So to curtail that, the UN put up the Saracusa principle to prescribe conditions that must be met before the fundamental human rights of an individual can be violated for public health reasons. So Saracusa principles, and these principles, there are 5 of them, and they include that the restriction is provided for and carried out in accordance with the law, which means that before you restrict the fundamental human rights of an individual, it has to be provided for in accordance with the law. So in public health, when there is a health crisis, or when there's an emergency like the COVID-19, the first thing they do is to declare a public health emergency. Once a public health emergency is declared, it means that most of the laws are suspended. Okay? And that emergency state gives the government all the powers it needs to contain the emergency. Yeah? It means that, which means that government becomes more powerful. And for this to happen, it must be according to the law, which means that the government must pass a law, an emergency law, before going ahead to restrict the movement or to restrict the human rights of the citizens. The second one is that the restriction is in the interest of legitimate objective of general interest. So the restriction should be necessary. Restriction should be necessary. For example, during the COVID-19, lockdown is necessary. It's necessary to stop the spread. Was necessary to stop the spread of the epidemic. So, which means that the lockdown met the second criteria, which is that the restriction should be in the interest of a legitimate objective of general interest. The third one is that the restriction is strictly necessary in a democratic society to achieve the objective. So, which means that the Siracusa principle only applies in democratic societies. And in democratic societies, you usually have three arms of government. You usually have three arms of government. You have the executive, who will propose the law. The legislature will deliberate, and in the legislature you have representatives of people who should be able to say something if the law is too restrictive. And then you have the judiciary is also there to interpret the law, to ascertain if it is consistent with all the other laws, especially with the Constitution. Okay, so yes. So the fourth one is that there are no less intrusive and restrictive means available to reach the same objective. Okay, so in the case of COVID, during the COVID-19, lockdowns were used until vaccines came in. Until vaccines were developed. Okay, vaccines are less intrusive, and that is why. So that is the reason why lockdowns were abandoned when the vaccines came about. So the introduction of vaccine met this justify the stoppage of the lockdown. Okay. The fifth one is that the restriction is not drafted or imposed arbitrarily. That is in a discriminating manner, which means that the restriction should not be such that it targets an individual or a group of individuals. So it should not be discriminated. It should apply to everyone. It should apply to everyone. Okay, in developed societies, even ministers and the head of states, like Prime Minister, they were all expected to obey the law. One of the reasons why the British Prime Minister during the COVID-19, Boris Johnson, was removed was the fact that he was found in multiple occasions to have breached the COVID-19 regulations. Okay, so those are the 5 reasons, 5 principles that must be met. That must be met before the fundamental human rights of citizens can be curtailed for public health emergencies. And even at that, the restriction must have a time limit. You don't impose restrictions indefinitely. You don't impose restrictions indefinitely. There must be a time limit. There must be a time limit. There must be a time limit. And if you notice during the COVID-19 pandemic, they will always they will also say, okay, that the lockdown is for 2 weeks. And after that, they review. So the restrictions must have a time limit. Restrictions must have a time limit. Okay? The other one is that the individuals, citizens the purpose of the restriction must be or should be explained to the general public. The purpose of the restriction should be explained to the general public. Should be explained to the general public. Okay, so we now now stop. I'm now stop for questions or yes, comments. Do you have any question or comment on what we have discussed so far? Questions, comments? Okay. Ige. Hello, Ige. Hello? Hello, Luatosi. Okay. Onyesolom. Hello, Onyesolom.
Yeah.
Hello?
Okay. Hello?
Yeah.
Sorry, Prof. I didn't know I was muted. Thank you so much, sir. So, you established in our discussion this evening that we cannot sue the government when they fail to provide like health care services to us. So, I want to put into context the issue that happened at the University of Uyo and the EFCC issue that happened about 2 months ago. So, in that context, does it mean that any casualty that could have happened during that day or at that period, the family cannot do anything or the person cannot sue the government? That's one.
No.
Okay.
No. Okay, just complete.
That's the first question. Then the second could be that what could have the teaching hospital, what could have done in terms of engaging the EFCC in terms of the occurrence or the event? Thank you.
Okay. Anyway, probably I don't have the full information except the aspect I had on the news. But the thing is that this one is in another situation. This one is probably a community suing the government for not providing them with health services, not an individual. Not an individual. An individual can sue any government agency if he or she feels that his fundamental human rights have been tampered with, have been breached. Okay. Yes. Yeah. So you can sue a government agency. You can sue. Okay. But in what we are discussing is provision of healthcare. Okay. Oyesolo. Hello. Oyesolo. Okay. Feresima. Hello, Feresima.
Yes, sir. Good evening, sir.
Yes.
Thank you very much for the presentation, sir. I have one question and just one little addition. My question comes to equity. You know, when we're talking about equity in the clinic setting, we can say, okay, you can distinguish it by saying, based on the degree of illness of a patient, you see the patients that are worse as opposed to the patients that are less ill. But in the public health setting, apart from the example you made of using maternal and child care, I would like to know what is the criteria used to quantify equity. Because if we are saying that it is unfair for there to be less hospitals in the rural areas, but then the population in the urban area is more, so there should also be more hospitals in the urban area. And you said something about equity not reducing, but rather stabilizing and meeting up. So I would like to know, how do we quantify this equity?
Yeah. Anyway, let's just say that in public health, you have budgetary allocation. Money is voted. Okay. So that money is how to distribute that money. That is what determines equity. When you provide health care, yes, for example, health facilities are provided in pyramidally. You have the primary health care. Primary health care should be available to as close as possible to where people work and live.
Okay.
And then, and it should be the first point of treatment. Okay. And then, so it should be as close as possible. Perhaps in people's communities, wherever they are, they should have primary healthcare center. And then above the primary healthcare center, you have the general hospitals. General hospitals, where that should treat more serious illnesses. Okay, those ones may be at the local government level, whereas primary care centers are usually, I think right now, they usually talk about they should be available at the ward level. Then you have a local hospital at the local government level, and then tertiary hospital probably at the state level. So all of them work together to provide the care. But later you will talk about what is called accessibility, not only physical accessibility, but financial accessibility. Means that the ability to pay for the services, because it's not enough to have the facility within, very close to you. If you cannot, if the services are so expensive, you may not access it. Access it. It's like if somebody pays your hotel bill in a 5-star hotel, and then you have to pay for your meal in that hotel. If you're a regular civil servant, you will know that it's not cost effective to go and pay for a meal there in that 5-star hotel. You just walk across, and if you see any small restaurant, you go and eat. So that is how that financial accessibility is also important. Okay. And the other thing you mentioned about the hospitals and treatment, it's called triage. Is because you want to treat those with serious illnesses so that they won't die. I think it's the thing there is there's a likelihood of death if not treated immediately. That is what is used to happen. What determines the cases to see first.
Yes,
okay. Thank you.
So about my contribution, you said something about militants. You were talking about the amnesty program.
Yeah.
You said it was unfair for militants to be given scholarships and payments just because they took up arms.
Yeah.
So I wanted to say the Niger Delta militants, that is the amnesty program. At first, it started in River State. It started in River State as a test study. The initiative was not just about giving militants arms because militants aids because of they took up arms. It was more like the reason behind the arms and then the amount of damages they did to the country at large, in the sense that we were busting
is to stop them from
money.
Is to stop them, man.
Yes, but they themselves, before they picked up the answer, because of the level of oppression.
Okay, level of oppression,
and poverty, because of what these
poverty
have been doing to the waterways and the rest, and then the siphoning of our natural resources to the north.
Yes, so it was a trade-off, eh?
It was a trade-off. Just shut up money. Okay,
shut up money.
Yes, we see where you're coming from. Take this and keep quiet so we can keep siphoning the things you're giving. It was not a favor. It was not a favor from the government.
It wasn't a favor.
Yes.
What is it? Okay, you call this shut up money.
Yes.
So those that didn't weren't involved, they don't deserve shut up money too.
Actually, the program was supposed to be in 2 parts, but then you know the way Nigeria is. It was supposed to get the people with the arms, give them certain benefits.
Okay, it's all right. Tracy Febresima. Okay, that is good. You know, I know of a relative that got his name included on that list, and then he actually benefited. He actually benefited. So yeah. Okay. Thank you. So Onyesolom not responding. So we can go to Nancy. Nancy Adema. Hello, Nancy.
Hello.
Yeah.
Hello, good evening, Prof.
Good evening.
Yes, I can hear you.
Yes, thank you. Yeah, thank you, Prof. Please, I just want to ask a quick one. I want to ask, although it's also together with the last person, I just want to ask, is amnesty program part of a program designed to achieve equity and social justice? Is
No,
it part of it?
we gave that instance that it shouldn't be so. Anyway, that's my own personal opinion, although Tracy has a contrary opinion. But I'm just saying that the resources should be distributed based on the needs of the people. And that need should be that basic need of, if there is money, you have to share it to ensure that the basic needs are provided. And everybody is empowered. And there are ways government do it. Say public schools. Like in my own instance, the public school I went to was top quality, and we had all sorts of persons there. And because of that, people from poor families, they got very good education, and they became doctors, lawyers, professionals, and they have climbed what they call the social ladder. That is how the money is spent. Then health services, if you provide quality services in government hospitals, and there's a way you do it. If you do social insurance, it means that you will not die for not having money. Yes, in a lot of these Scandinavian countries, people don't save as much. People don't save much, what they call rainy day, because even if they run into difficult times, the government will bail them out. The education of their children will be assured. The health services will be assured. So they are not under that pressure. And that is how the money should be spent, in a way that it benefits all, not those that you are afraid of. You pay them off, or you give them short of money. No, it shouldn't be so. It shouldn't be so. Yeah. It's not the animal world where the survival of the fittest. It's not. It's not. It shouldn't be. Yes.
Okay. Okay, thank you, Prof. Please, last one more question. I think someone asked that question, but maybe my network. I want to ask, is public health, do they have the power to sue people? And can they be sued as well? I heard that anyone can sue.
We will come to that, because that is the next aspect, which is legislation, public health laws, and the rest. Okay. Hello, Nancy. Nancy can go ahead.
Sir. All right. Thank you, Prof. Good evening, sir. Sir, you talked about Nigeria having the largest number of health workers, but health indices is one of the worst. So please, can you throw more light on that, sir?
Yeah, because of our population, the number of doctors and nurses and other health workers we have in Nigeria is about the highest. In fact, the highest in Africa.
Okay.
But our maternal and infant mortality, they are still very high. They are still very, very high. Women are still dying during pregnancy or childbirth. Children are still dying. Dying at a very high rate. Okay? And we are saying that even in Nigeria, we have disparities. We have disparities. They are much, much higher in the north compared to the south. In fact, even up to malnutrition. When there was final defense, and someone that did work, nutritional status of children in Northwest, he reported the prevalence of stunting, or what to call us. Children more than 40%, in fact, 44% he reported.
Wow.
Which means that more than 4 out of 10 children in Northwest are shorter than their age. Are shorter.
Okay.
So, and I don't know. I don't know. And you know that when somebody is stunted, if it's a child, if it's a girl, it means that her pelvic bone, her waist bone will be smaller. And if her waist bone is small, it means that she will have, when she becomes a woman and gets pregnant, it will be difficult for the baby to pass through, to come out through normal delivery.
Yeah.
And what if the poverty continues and she requires a CS?
Okay.
That will be, it's either that she dies or she develop obstetric injuries like VVF, where she'll be leaking urine involuntarily. So,
Yeah.
so that is it. That is it. And I don't know, especially when I heard, in fact, when he mentioned that 44% prevalence of stunting, even the external examiner, we shouted, we thought, we doubted his figures until I went to the National Demographic and Health Survey and found out that it was actually true. Okay. Okay, so thank you very much. So we just move on to the next. Still, we are through with the ethics. So let's look at the policies and the laws of public health. Policies and the laws of public health. Let's say that in public health, we have three different interventions. In public health, we have three main weapons. We have the biomedical technologies or remedies, biomedical remedies. We have health education, and then we have legal and regulatory approach, which is use of laws. Okay, so in public health, we have biomedical technologies like drugs, like vaccines. We use health education to convince people, to tell people what to do, when to do them, and how to do them. And then we can use laws. We can use laws to force people, to compel people to do the work. To behave well or to take certain actions. Okay, when it comes to biomedical technology, in public health, we use drugs and we use vaccines and we use other things. But when we do that, we administer it to everybody in the community or in the community, irrespective of whether they are infected or not. Irrespective of whether they are infected or not, or whether they have the problem or not. Example is mass chemotherapy, where a drug is given to everybody in the community, irrespective of their infectious status, and it is used when the prevalence of infection is very high. Prevalence of infection is very high. For example, I'm sure that you must have heard of mass deworming of children. Mass deworming of children. So it is assumed that a lot. So children, especially those in rural areas that don't have good toilets, that do open defecation and the rest, that children, they have a high level of worm infestation. Okay, so because of that, the warming exercise is carried out. In that case, now you don't need to even treat a woman. Sorry, you don't need to even test the child if the child has a worm. Or you just go ahead and then deworm all of them. And the same thing is done for pregnant women. Pregnant women, in pregnant women, they are all given Hematinics, irrespective of whether they have anemia or not. They are all given Hematinics. So in public health, we use what we call mass. When we use drugs, the likelihood is for us to give it to everybody in the community, especially when the level of infection is high. Mass chemotherapy. The other way we use drugs is what they call food fortification, especially when we add micronutrients like iodine, like iron, like vitamin A into staple foods. So, which means that as people eat the staple food, they are in addition taking in these micronutrients. For example, cassava. A lot of us, cassava is very, very premium. We eat a lot of cassava in southern Nigeria. Unfortunately, cassava contains glycosylated cyanide that antagonizes iodine in the body. So if you don't take adequate iodine, the person and you eat cassava TDS 3 times a day or frequently, you may likely come down with goiter. So it's one of the reasons why almost all flour, a lot of things, sugar, and a lot of things are iodized. Salts are iodized to make sure that all of us that we take enough iodine. Then the other thing we talked about, we have mentioned the mass compulsory vaccination in the history part of this course. So mass compulsory vaccination is one of those ways that we do in public health. In public health, we do mass. We treat almost everybody through compulsory vaccination, food fortification, and then mass chemotherapy. We do that. Then for education, we also use education, health education. Health education is not just to move stuff. It's not just to tell you things. But health education, we can tell you things you don't know, provide new information. If you provide new information, that is usually the first step. And then for patients with chronic diseases like diabetes, we do diabetes self-management. Self-management education is given to the patients to teach them what to do, when to do them, and how to do them, especially as diabetic patients are responsible for more than 95% of their health care. So because they provide most of their health care, the best thing to do is not to even give them, recommend the best endocrinologist to manage them, but actually to treat them. Actually to teach them what to do, when to do them, and how to do them. And then we also have behavioral change communication. Behavioral change communication. When behavioral change communication, when we try to change, to discourage, to assist persons to change their harmful, unhealthy behavior, such as cigarette cessation programs and so forth. We do social marketing, where we use marketing techniques to encourage people to carry out where we use commercial marketing techniques to encourage people to patronize health services. Then community mobilization, where we mobilize members of the community to help with health services, and then health services and the other ones. Then the last one is we use laws. But to tell you the truth, that we use law as almost like as a last resort. We use laws as last resort. Although public health started with laws, with the appointment of medical officer of health and the sanitary inspectors, who went around looking for insanitary condition and then using the law to compel people to do that bid. And that is probably the reason why the modern incarnate of the sanitary inspectors, look at them. They are dressed like law enforcement agents. In fact, technically, they are law enforcement agents because their responsibility is to enforce the public health law. They go out looking for nuisance and then compelling people to do that. Okay, so then we also have custom and traditions, which customs and traditions are practiced in traditional societies. They are ways of doing things. They are ways of doing things. Some of the ways they do things in the community, let's just say that several of them are beneficial, like breastfeeding. Like breastfeeding, they are beneficial, but some are harmful, like the so-called female circumcision, which is actually female genital mutilation. And even scarification marks. Scarification marks are not too advisable, especially because those doing the scarification may not use sterile equipment, and therefore there may be problem with the transmission of blood-borne infections like hepatitis and HIV. So these harmful traditions, we have to find a subtle way. We have to find subtle ways to discourage their practice. We have to find subtle ways to discourage that practice. In fact, at times they are even banned outrightly. They are banned outrightly, such as child marriage, Remember what also happened with Oguntala Sapara and the Shoponu worshippers. Some worships, if they are found to be causing public health problems, they can actually be banned. So these are the things. So let's talk more about the laws. There are differences. We have policies and we have laws. We have policies that have laws. They are related, but they are not exactly the same. They are related, but they are not exactly the same. A policy is what guides a decision. A policy guides decision. So government policy guides decision, and that is what they will expect us to do. But the problem is that policies may be obeyed. Policies may be obeyed. It is not mandatory for you to. It's not mandatory for you to comply with government policy. It's not mandatory. You cannot be charged. It's not an offense not to comply with a government policy. But government usually finds a way to compel people to obey its policy. For example, the national policy on population, national population policy is national population policy recommends 4 children per couple. 4 children per couple. Okay, so it is not an offense for you to have more than 4 children, but government has made it very economically, has actually indirectly imposed economic fine for disobeying that policy. For example, social insurance, you can only 4 children can benefit. Health insurance, only 4 children can benefit. Okay, even tax, even tax, you can receive a reprieve, tax rebates for each child, but only up to a maximum of 4 children. Okay, so there is an indirect way of putting pressure on people to comply with his policy. Another example is immunization, childhood immunization. We are encouraged, we are encouraged to immunize our children, but people cannot be fine, will not be deemed to have committed an offense if they fail to immunize their children. Okay? So, but government also has a way of compelling people to ensure that their children are fully immunized. And that is when the child is to be registered to go in, to be registered to go to school. The requirement is that the child must be fully vaccinated. Okay, so that fully vaccinated, so that puts a lot of pressure. That puts the pressure on parents to ensure that their children are vaccinated. Okay, so the difference between policy and law is that, of course, a policy, you may decide not to, but laws must be obeyed, no matter how bad the person considers it to be. A law must be obeyed. Once a law is passed, your opinion about the law is immaterial. If you go against the law, you can be charged. You'll be deemed to have committed an offense. An example is the abortion. In the US, where you have the pro-life and the pro-choice, people are a woman that is, say, pro-choice, no matter how feminist you are, no matter how much you believe that you should have full control over your body, if you go on to carry out an abortion in Nigeria, you will be deemed to have committed an offense, irrespective of how feminist you are or what you feel, irrespective of what you feel. Okay, so that is that is the basic difference between a law and a policy. And laws are of different types. You have the ordinance, you have the bylaw, you have the decree, you have the edicts, and you have the acts. The ordinance is a law that is passed by the executive arm without the input of the legislative arm of government. A bylaw is a law that is passed without the input of the legislative arm of government. Then we have examples include those in the colonial days. Local governments didn't have legislative councils, so the laws passed by municipal councils during that period, all ordinances and then we have the bylaws. Bylaws are the laws passed by local governments. Bylaws are laws passed by local governments. They are called bylaws because they are derived from laws previously passed. They are not entirely new laws, but they are derived from laws already previously passed by the state or the federal government. So that's why they are called bylaws. And bylaws are laws passed by the local government. Bylaws are laws passed by the local government. Okay? Then we have decrees. Decrees and edicts are laws are enacted by the military government. Decrees are passed at the federal level, while edicts are enacted at the state level. Okay, so even the laws, the true laws, the ones that are passed by, true laws are the laws passed by the in a democratic setting, with the contribution of both the legislature, the executive, and the judiciary. And these laws can be classified into private laws and public laws. Private laws are the laws that guide the relationship between individuals, like contracts, like partnerships. While public laws are laws that guide the relationship between individuals and government, and then between individuals, almost like a private law. But in this case now, government steps in order to ensure public order. For example, murder. If you commit murder, you have it is the government that will prosecute you on behalf of the dead. So that when he removes the obligation. This removes the obligation of the relatives of the deceased from seeking justice. Government will just take over. And then the public laws include the constitutional law and the administrative law. And of course, we also have criminal laws. The constitutional law, which is also called the Constitution, is the grand norm, is what is above all the other laws. It grants the basic rights of citizens and then establishes the relationship between the three arms of government. And of course the three levels of government. The three arms of government and the three levels of government. So the Constitution is the highest law. The Constitution is the highest law. The Constitution is the highest law of the land. Constitution is like the highest law of the land. And before although we have different constitutions, starting with the amalgamation. Nigeria's at amalgamation in Nigeria in 1914 had this amalgamation constitution. And after that, even the colonial governments, they have different constitutions. The current one is the Nigerian, the 1999 constitution as amended. It has been amended. Okay, it has been amended, but it takes to amend a constitution is a big tax. It's a big tax because it is not just the National Assembly that does that, but it must have at least what they call the two-thirds concurrence of the other of the state of all the states in the federation, of all the states in the federation. So it is difficult to amend the constitution. Whereas then the other type of law we have is the administrative law. It is the administrative law that sets up government agencies like public health agencies like NAFDAC, REWEM, NOSRA, and the rest. This administrative law gives the public health agency the power to do its own work. We are going to look at the various responsibilities. But the other thing we have to talk about is that the administrative laws of these agencies grant them what they call the dedicated powers. Dedicated powers. It gives the agencies the power to make further laws. And the laws made by agencies are not technically called laws, but they are called regulations, rules and regulations. Okay. For example, NAFDAC has its own establishment law, and within that establishment law, it has it can make rules and regulations guiding, for example, the production of pure water and all the other things. Okay, so dedicated law. Then let's go to okay. Okay. Let's see. Okay, I think we can. Let's see how far we can go. Okay. Okay, so we just look at. We have talked about the Establishment Act, those the law establishing the agency, public health agencies. We have to also go to look at the powers, the statutory powers given to public health agencies. And these statutory powers, there are 5 or 6 of them. The first one is the power to tax and spend. The second one is the power to alter the informational environment. The third one is the direct regulation of persons, individuals, and professionals. The fourth one is the use of the tort system. And then the other one, the final one is deregulation. The first power, the power possessed by the public health agency, the first one is the power to tax and to spend. The power to tax and to spend. The power to tax and spend is one of the powers granted to public health agencies. And these powers include having the ability to tax, to offer tax relief, to encourage good behavior, and then use a tax fine to use tax burden to discourage bad behavior, and then conditional benefits to encourage certain behaviors, to give benefits in exchange for certain behaviors. These are the 3 ways in which public health agencies can carry out, can exercise their power to tax and to spend. For tax relief is used as an incentive to encourage certain behavior. For example, things that are imported, you want to offer import duty waivers like drugs to make them cheaper. If they are cheaper, it means that people can buy. Makes them, if they are cheaper, they are affordable, so people can buy. Okay, so it's a way of encouraging the use. So one of those things that currently enjoys tax waiver in Nigeria include drugs. Include drugs and insecticide-treated bed nets. Okay, insecticide-treated bed nets. Okay, so and then in hospital services, in government hospitals, the principle is that you pay for curative services, and then while preventive services are provided free of charge or at significantly reduced prices. Okay, so that is the reason why immunization services are provided free of charge. Immunization services are provided free of charge because they are preventive. So the government policy in Nigeria is to subsidize or provide preventive services free of charge, while curative services are paid for. Okay. Then that also brings us to what we call the public health good. You would have heard of public health good. Public health good is defined as things used by an individual that benefits not only the individual, but also members of the community, country, and the world. So public health goods are usually subsidized or given free of charge, because the person using it, the benefit is not just for the person using it, but others. So it is actually in the interest of the government or even governments all over the world to encourage people to use public health good. And we said during the section on international international health, we are talking about those commodities they commonly commodities that are commonly called public health goods, like vaccination, like family planning, vaccination, like family planning. Okay, so the other way the government, the public health agencies, the other way the public health agency exercises its power to tax and spend is the use of tax burden. Tax burdens are used to discourage people, to discourage bad behavior, by making the products more expensive, In several developed countries, alcohol is taxed. To make it, is heavily taxed to make it more expensive for people to get drunk. More expensive for people to take drunk. In fact, alcoholic beverages are usually taxed per their alcohol content. So the higher the alcohol, the more tax, the more the product, the drink, the beverage is taxed. Okay, and then there's also the sugar tax, especially for carbonated drinks. The higher the sugar content of a carbonated drink, the more the tax. Okay, the more the tax. Okay, and this is to discourage people, discourage the consumption of these carbonated drinks, which have been shown to increase the risk of diabetes. Okay, and the other risky service that is commonly taxed is prostitution. In developed countries, prostitution is legalized, but prostitutes are required to register, and then they are taxed. They are heavily taxed so that their services will be more expensive. And because it's more expensive, people their patronage will be lower. Okay, so in developed, so it is unlike Nigeria where they are banned, and where they are banned, and government doesn't get anything from them, any tax doesn't. The government doesn't get any tax from them. Meanwhile, they infect people with STI, sexually transmitted infections, that put pressure on the government health service. So in developed countries, they are legalized, and then they are meant to pay tax. Okay, and because they are heavily taxed, their services are higher. And that is a way. That is what I consider is a better way of controlling their services. Okay, of controlling their activities. Okay, so conditional benefits is when you give a benefit, some benefits. It can be a financial payment. It can be a food in exchange for certain things, patronage of certain services. For example, during this Jonathan administration, that is under the NDG, they have this conditional cash transfer in which they gave money. They gave money to households in exchange. The household is expected to have their children fully immunized, and then ensure that their children go to school. So when they show evidence of this, they were usually giving money. In fact, during that Jonathan period, they were given 5,000 naira monthly. Okay, that is a conditional benefit. It seems okay. So let's just take this one. This the power to control the regulatory agencies, the power to control the informational environment, the power to control the informational environment. So public health agencies also have the power to control what people hear. They control what information is made known to the public. And although this was in the era before the social media, but even at that, public health agencies still exercise this power to control the information provided to the citizens through the following methods: product labeling, regulation of advertisements of unhealthy products, establishment of standards in the advertisement of food and drugs, and then ban on self-advertisements of medical and medical practitioners. For the labeling, it is required. The public health agencies, they require public health agencies, they require that products, especially harmful products, are labeled in certain ways. For example, NAFDAC requires that every product must have a brand name, a complete location address of the manufacturers, batch number, best before date, net content, and then if they have added additives, if they added the food additives and colors, it has to be clearly stated on the label. It has to be clearly stated on the label. And at times they insist on the inclusion of health warnings. They also insist on the inclusion of health warnings. For example, alcoholic beverages are supposed to be clearly written, not for people below the age of 18. And then drinkers are also admonished to drink responsibly. Then for cigarettes, we also know that they have health warnings. They also have health warnings, and it is said that and those health warnings in Nigeria includes Federal Ministry of Health warns that smokers die young, or smoking kills, or some other health warnings. And then it is also required that the processed foods should contain the nutritional facts, nutritional information, the protein content, the sugar content, and sodium content, etc., in order to guide the choice of patients. And in some countries, especially foods for diabetic patients, the glycemic index of the food should also be indicated. The glycemic index of the food should be indicated. Glycemic index of the food should be indicated. And then we also have some religious certifications, like the halal. Halal certification certifies that the product had been processed strictly according to Islamic injunction. I'm sure that a lot of us haven't noticed that. But if you just go after this lecture, just check out this symbol, this halal. This symbol indicates that the food or the products have been processed with strict compliance to Islamic injunction. Okay, so it tells the Muslim buyer, the Muslim customer, that indeed the food was processed in strict adherence to Islamic injunction. Okay, so there is also a ban on the advertisement of products before certain times. For example, alcoholic beverages shouldn't be are not to be advertised before 7 p.m. are not to be advertised before 7 p.m. Of course, I'm sure that was during my childhood days when televisions were usually open around television stations were usually open around around 4, and then yes, that's 4 p.m. to 7 is considered or was considered the children belt where they show children programs. Okay, so alcoholic beverages were not supposed to be advertised during those periods because children were deemed to be watching during that period. Unfortunately, now we have 24-hour television. Tobacco should not be advertised. Tobacco shouldn't be advertised in any form, in any manner, not even in billboards, t-shirts, even carrier bags. Total ban, total ban, total ban, total ban. And then drugs should not be. There are also requirements on the advertisement of drugs. Drugs must not be advertised to have no side effects, because there is no drug without a side effect. No drug without a side effect. I know that some persons will say, that drug is natural. No, it doesn't, because of course poisonous mushrooms are also natural, but they are dangerous. They can kill within hours. So, and don't be deceived. In fact, it is illegal to advertise that a drug has no side effects. And then there are certain things that must not be advertised in hospital. For example, baby breast milk substitutes or infant formulas are not to be advertised in hospitals as part of the baby-friendly initiative to promote exclusive breastfeeding. Exclusive breastfeeding. Promotes exclusive breastfeeding. And then there is also a ban on the hawking or the sales of drugs in buses, or other unapproved places. Because if you buy in buses, you'll find it difficult to trace the person that you bought the drugs from. And okay, it has been said that most of those drugs that were sold in buses at very discounted prices were either expired or counterfeit drugs. Okay, counterfeit drugs. Another thing too is that drugs that require doctors' prescriptions are not advertised in the mass media, but rather they are usually advertised in journals where read by only medical practitioners. It is also illegal to advertise alcoholic products in ways that target pregnant women. It is illegal because pregnant women are not supposed to drink alcohol. Then certain self-advertisements is banned. Doctors are not expected to advertise their services to the general public. Okay, and the NDCN sees it as a malpractice. Okay, so these are the ways in which the Public Health Agency controls the information environment. I don't know if there are questions or comments. We are going to end here. So after taking the questions and comments, we are going to stop here. Tomorrow we will complete the course. We'll take the police powers and then the litigation that public health agencies can actually carry out. I don't know if there are questions. Okay, we have some names.
Yes, sir. Yes, sir. Good evening, sir.
Good evening.
Yes, sir. Thank you, sir, and well done for this wonderful presentation, sir. My concern is just based on those banning of advertising of that baby-friendly, just to minimize or to increase the exclusive breastfeeding in the facility. So I don't know, maybe some in some way, whether because for those people that have been other special or exceptional difficulties, like people who have been infected with HIV, which maybe of them they will not maybe continue breastfeeding due to the exposure of maybe the virus to be transmitted through breastfeeding. So though which they may like even to be sensitized. I don't know.
No. If it is a prescription, is the doctor that will be prescribing it.
Yeah. Okay.
But not breastfeeding is not the standard recommendation for HIV positive patients. HIV positive nursing mothers. It's not the behavior. They are encouraged to actually breastfeed. The emphasis is ensure that they get virally suppressed.
Yeah.
Okay.
Thank you, sir.
Hello, Nancy. I don't know if it was the old hand. I don't know. Nancy?
Okay, sorry, sir. I think it was the old hand. I'm sorry, sir.
Okay, no problem. So we'll go to Moritala. Hello, Moritala.
Hello, good evening, Prof.
Yes, Hassan. Good evening.
Yes, sir. I have one is a question and the other one is an inquiry. My first question is that we talked about ordinance as one of the types of laws we have across the country, that it is passed by the executive without the involvement of the legislators.
Yeah.
And again, there is what they call executive order. So I would like to know, is there any difference or similarities between an ordinance and the executive orders? That is one.
Okay.
Two, and the other one is that is the issue of that certificate for those who have attended that bridging course, that we have never heard of any teacher, and there is no medium where we can maybe address our inquiries, at least for now. So that is why I'm using this opportunity to ask directly. Thank you.
No problem, Hassan. I don't know. I think we have, for the bridging course, we have a WhatsApp platform. I don't know if you're on that platform. And then I think it's started issuing. Yes, I think what will be required is just to provide their details, and then of course, if you pass the prescribed exams, then you'll be issued. It will be issued to you. Okay. As for the executive orders, are actually made by the executive, probably the president or governor, but they are derived from other. They are derived from other from already existing laws, but they are putting them together. They are proclaiming they are making that executive order to achieve a faster results. Faster results. Yes, faster, to make it faster. You know that at times you have multiple laws guiding one or two things, but with the executive law, the various laws are summarized, and yes, and then Usually executive orders are said to be policies and not law.
Okay.
Yes,
Okay.
they are classified as policies. They're almost like a government policy. Yeah.
Okay.
Yeah.
Thank you.
Yeah. Where Ipinabo? Tubomie? Hello?
Yeah, good evening, sir.
Yeah, good evening.
Okay, I have about 3 questions to ask briefly. First, you kindly mentioned while lecturing about the advert of drugs in buses in commercial transports, and it's quite common in this part of the country where we get to see a lot of people transmuting, and then they are also advertising drugs, especially drugs that are not necessarily recommended. We get to see herbal sales of herbal drugs and all of that. I would kindly want to know what has been done to reduce, because we know the harmful effects. Sometimes people travel and then hear some of these things, and you just shake your head in amazement. So I want to know, are there laws against that? And if there are laws, how well has it been implemented? Then secondly, I overheard when you mentioned that it's against the MDCN, that's the Medical Dental Council of Nigeria, against their laws that doctors shouldn't do advertisement. So I would also kindly want to know why that is. And lastly, I would want to know if doctors are prohibited from doing adverts, is it also prohibited that hospitals do advert? Because scarcely we even see hospitals turn up in doing advertisement. They only just put signposts and people see and just walk through. Thank you, sir.
Yeah, thank you. Let's start with the adverts. The thing is that there is a law. What we said is a law, is a government, is a regulation, and they are supposed. There's a law, but the problem is the enforcement. Is enforcement. Who enforces it? Who enforces it? Who enforces it? Perhaps the pressure will have to be put on the drivers to ensure that it becomes culpable for whatever happens, and that will discourage them from from allowing such marketing to take place. So there is a existing law. As for the advertisement of health professionals, medical doctors, it's just to ensure that people with the best adverts don't necessarily have the best service. Okay, so that is the reason why. That is the reason why it's so, to discourage, to ensure that doctors get patronage based on their competence and not based on the amount of money they spend in carrying out adverts. As per hospitals, yes, as per hospitals, I think we are beginning to we are also confused in Nigeria, because we are torn between the US and the UK. We derive a lot of our laws from the UK, but we look more towards America. In the UK, they have the National Health Service. So basically, their hospitals, most of their hospitals are in effect public hospitals. So, which means that there is actually no way, there is no need for you to market the hospital. Market the hospital. But in the US, where it's a private sector, they are allowed to. They're allowed to do some marketing. They are used to do some marketing. Yes. But the other thing too is that they try to make sure that you don't begin to go and claim that you are better than the others, better than your colleagues. No, you shouldn't. You can only, even in the US, you cannot say that you are better, but you can tell people about the services you provide. about the services you provide. You can tell them about the services you provide, but not to begin to cast down the others for you to, yes. So that is the thing. Okay, that is
Thank you,
the one.
sir.
Yeah, thank you. Adako. Hello, Adako.
Hello, Prof. Good evening, Prof.
Yeah,
Thank you
good.
very much for your lectures. Very interesting and engaging, and your mode of teaching. Thank you. So my clarification has to do with I didn't quite understand clearly the difference between ordinance and bylaws, and also I needed maybe a bit more clarification too, or expansion on public and private laws. Are these two different, this ordinance and bylaws? I know you mentioned that there are 5 different types of laws: ordinance, bylaws, edicts, and some other too. But so where does this public and private laws now come in? Is it a different type of classification on its own? Thank you, Prof.
Okay, thank you. Okay, let's just say that ordinance are laws passed by without are law passed without the input of the legislature. And you find it mostly during the colonial period or during the local government before the 1999. So in the colonial government, you have local government councils that the councillors are elected, and they've become like, it's almost like a parliamentary system. It's almost like the councillors they have mostly the executive powers. They can also make laws, and those laws were called ordinance because they were basically made by the executive alone. But right now in Nigeria, all local government areas in Nigeria they only have bylaws. They can only make bylaws, even though they have legislatures. They have legislature. They can only make bylaws because they are local governments. They are only allowed to make laws that are derived from already existing laws. So if if the state government has a law, or say on market, the local government can make its own law, probably adding 1 or 2 things to the market law already made by the state government. So that's why the laws made in local councils are called bylaws, because they are derived from other laws. Okay. You talked about the different, private and public law. Okay, so you rightly mentioned there are actually five types: the ordinance, the bylaw, the edict, the decree, and what we can call the acts. The acts of the parliament. The acts of the parliament are technically the only real laws, because the real laws are passed by the acts of parliament, by the parliament. Okay, so that's why they are called the real laws. Okay, but these laws are classified into 2. You have the private laws that guide the relationship between persons. Private laws that guide the relationships between persons, agreements, and contracts and the rest. Okay, then we have the public laws. Public laws guide the relationship between the public and the government. And then there is a special type of public law that is actually private, because it has to do with relationship with 2 individuals. So if there's a quarrel or physical fight between 2 individuals, the government has to step in to separate that fight. And that is figuratively to separate that fight, and that is another component. That is another component of another component of public law, which is called criminal law. So criminal law is almost like both public and private laws. Let me see. Where is that now? Okay. Yes, criminal laws are technically private laws because they relate to the relationship between persons, but they are of concern to the society because they can disturb public peace and harmony if not properly handled. For example, murder. For example, theft. Theft involves two persons, one stealing and one being stolen from. Okay, so it's only governments will now come and settle the matter based on that. Okay, I hope I have provided that clarification. Madam?
Yes, thank you very much. Thank you, sir.
Okay, thank you. Okay, we have Sophia. Hello, Sophia.
Good evening, sir. Sir, thank you very much for your lecture. My own question or comment is about the abortion law. Studies have shown that even with the abortion law in Nigeria, over 5,000 abortions are done every day in Nigeria. And yearly, we have about 0.8 million abortions done daily. And in the hospital, we receive cases of complications from abortions, like sepsis, and is even contributing to increased maternal mortality. My own question, why do we have this law when they are not enforced? Don't you think that this abortion law is even causing more harm than good? Because women are unable to access professional services to perform abortion. So now they are now going to quacks to get these services. And it's affecting our health indices.
Yeah. You know that at times it has a lot of traditional and religious undertone. You know, in the US, the fight between the pro-life and the pro-choice, very big fights, very big fights. And then Nigeria is still a traditional and religious society. You know, so a lot of people, if you begin to what is it called, campaign for that, they will think that you are immoral or something like that. But just as you said, it's the truth. It's the truth. It's the truth. But the only thing is that it's the truth. Yeah, yes, it's the truth. You know, at times now they don't even call it abortion in Nigeria. They call it menstrual regulation. Okay. Okay, Ojinaka. Sorry,
Yeah, Ojinika.
Ojinika. Sorry,
Yeah.
Ojinika.
Thank you. Good evening, Prof. Thank you for your presentations. I only want to comment on two things. Firstly, about the HIV positive mothers. Yes, since 2020, there has been a law by the Federal Ministry of Health on maternal, infant, and young child nutrition that states that HIV positive mothers cannot breastfeed their babies for 2 years or beyond.
Yeah.
They can breastfeed like a normal child. Perhaps she's taking that there's a certain drugs they give both her and the child.
Yeah.
So once the mother is taking that, the mother can breastfeed as many years as you want, and the child will come out negative. So it has been in the law since 2020 and is still effective. And we have also recorded good number of mothers who went through that part and came back and their child were negative.
Yeah.
So it's no longer a new thing. Then
Yes.
secondly, on slide 222, that is the baby friendly hospital initiative. So now we've updated the law. It's no longer baby friendly hospital. Is baby friendly with a subset. Is not baby friendly initiative BFI with a subset of baby friendly hospital initiative, baby friendly community initiative, and the relaxed one. So maybe you can also help us to update the slide. So it doesn't look like there's anything like BFHI again. BFHI is now a subset of BFI.
Okay. Okay. So it's a baby friendly initiative.
Yes, it's now baby friendly initiative with a hospital initiative as a subset.
Yeah. So they are getting into the into the communities.
Definitely, it's a gradual process.
Okay.
Thank you so much.
Process.
Yeah,
that's good.
Thank you, sir.
Yes, thank you. One thing with our program, or this our program, is we have what we call the expert students. Expert students, those that are on the field, and they provide us with these updates. Thank you very much for that update.
Thank you, Prof.
So
yes, sir.
we are now in the community. So we are community baby friendly hospital initiative. Sorry, I'm still talking about the old.
So baby friendly initiative.
The baby friendly initiative.
Yeah, if you don't mind, I will share the links. I will share the links to all the updated documents by the Federal Ministry of Health. Yeah, there are a whole lot of policies that can help.
It's good to do that. To get other people on board.
All right, sir. I will do that. Thank you very much, sir.
Ehimen.
Yes, I'm here. Good evening, Prof.
Yeah, good evening.
Yeah, thank you very much for your always engaging lectures. Please, I have a general question. It's not necessarily relating to what you just taught. It's something that has been on my mind. Please, I want to know, apart from the theoretical aspect of public health, like the professionals here that are not medical doctors, other professionals here that are not medical doctors or nurses, I don't know, are we going to be given opportunities to be exposed to the practical aspect of it in terms of, learning how to vaccinate or giving vaccines and using other form of syringes? It has just been on my mind, so I said, let me ask if there will be opportunity for other professionals.
It's all right if you. Usually, we used to have an internship for our students, but because we have gone online and our students are all over. But usually, we also say those that show interest, we can organize something, an internship for them, and then they'll get so exposed. Okay, so noted. Ehimen. I hope I got that.
Vivian.
Yeah. Okay. You say?
I'm Vivian. Just call me Vivian.
Okay. Yeah, but it's Ivy. Okay. Okay.
I just my initial Ivy.
Yeah, that is good. That is good. I think I will remember that, so that I won't. If you notice, I wasn't even attempting to call the first part of the name.
All right, it's fine, Prof. Thank you very much, sir.
Yes, sanitarian Okon. Okon.
Yes. Yes, sir. Good evening, sir.
You want to give an abetment notice?
Not really, sir.
Okay.
So I have a question. Okay, good evening, sir.
Yeah. Go ahead.
My question is, you will see some boys in the evening, they'll be hawking these drugs of a thing. And if you enter some chemists or some provision shops, they'll be selling drugs inside, they'll be selling provision, and they'll also be selling pesticides in the same shop. So my concern is, what are we doing to curtail all this, since the enforcement aspect of the public health law is not that concrete at the time? So that is my question.
Yeah. Anyway, Okon, you were asked to go in search of nuisance, or things that can constitute a threat to public health. Perhaps that definition has to will has to expand now, such that it becomes
so
one
I'm
of
saying that
because it's
the
dangerous.
enforcement aspect of the public is not that concrete.
Yeah, it's not. Well, we have to look into it. Because that's why we are also insisting, or we are trying to emphasize during this the ethics aspects. And once you are giving, your responsibility is the whole to keep the whole community healthy. Although the most important, the interesting part of public health is the practical public health. The practical public health, where donors they bring money, immunization, HIV control, TB, all those ones. You have money there. So there is a tendency for the medical officer of health and others to concentrate on those public vertical public health. But what of the horizontal? What of ensuring that people in that area, in that community, in that local government, their health is assured? Look at what they are saying. If you are selling a drug and this thing, what of you that maybe cross contamination, spillages can become a problem? So I don't know. I think we need to really improve our enforcement, our enforcement arm. Okay. Thank you. Hello, Destiny.
Okay.
Hello, Destiny.
Good evening, Prof.
Yeah.
Can you hear me, Prof?
Go on.
Okay. Concerning the law against doctors advertising themselves and hospitals advertising, their services and all that. Let me speak from my own aspect. In Port Harcourt here, I don't want to call any names, but there are some hospitals that are always on social media, on television, advertising their services and indirectly advertising themselves. And some of these hospitals go as far as getting some of their patients to advertise, to further do some advertisement, marketing and all that, and while they are doing that, they are kind of putting down their other colleagues that are in the same, practice. So yeah, so these hospitals that do that, is it that they have like a waiver or so from the government, or are they not breaking some kind of laws? On what grounds can they continue doing these adverts and unchecked? And they're mostly fertility and body plastic surgery hospitals. So on what grounds can they go ahead and do all these adverts with impunity when they're actually breaking the law?
Yeah, we are talking about what happens in the US and what happens in the UK, and we are just confused as to what to do. But the thing there is this: if such, especially if it is recorded, it can actually be reported. Can actually be reported to NDCN, and they will be punished appropriately. But I also know that people have also used the ploy of providing health education. In fact, I have seen a doctor who has a very big practice now. In fact, he has made money. Let's just put it that way. And he started by what is called health education, having programs on radio, and then of course with that he will. People saw him as a go-to person, and he became an agent to those Indian doctors, and then He built up his practice from there. So the problem now is that people have used or have come under the guise of providing health education to indirectly marketing them. But this aspect that you reported, that one is criminal, and they can be punished. In fact, even the NDCN, the book, the rules and regulations, they even specified the size of your signboard. It's not you can't have a billboard and call it a signboard. Up to that extent, not to talk of having people to come and do that and do that. But I also know that, especially these beauty care things, people also do some adverts in that regard. Thank you. Okay, more hands are coming. Is it as a reaction to what Destiny said? Hello, Scholar. Scholastica.
Good evening, Prof. Thank you so much for your presentation and your lectures. I just want to make a comment on what I think Vivian said. About the HIV mothers, even with the drugs they take, they will have to do a viral load test to ensure that they are suppressed. When a mother is not suppressed, they will not allow them to breastfeed their babies. That's why they go for viral load tests.
No. If you listen, she was talking about they were taking drugs. Well, yes, I'm sure you are in the system. That's why you are talking about viral suppression.
Right. Yeah.
Those drugs are for that purpose.
Oh, yes.
And that's why they are called HARTs. They are called HARTs. They say highly active. Yes.
Okay. Thank you, Prof.
Yes.
Thank you so much.
Yes. Hello, Emanuela. Hello, Emanuela. Chigozie. Okay. Thank you very much. I think we can end here. Tomorrow will be it will be a short lecture because we have about 50 slides to cover. We'll be looking at the police powers. The power to regulate, persons. Already, I think usually exercised through compulsory vaccination, medical tests. The public health official has the power to compulsorily carry out a test on someone, and we are going to look at them. Then we'll look at the litigations. Thank you very much. Till tomorrow. Thank you very much for your contributions, and have the best of the rest of the.
Thank you, Prof. Thank you very much.